Most men over 60 believe that every prostate checkup is a safeguard, a guarantee of health. But here's the shocking truth. Some of the very tests you've been told are essential can actually do more harm than good at your age. Instead of protecting you, they may lead to dangerous procedures, frightening false alarms, and a loss of independence. The idea that more tests mean better health is not only outdated, it can quietly rob you of the very quality of life you're trying to preserve. I'm Dr. Mohit Khera, a urologist and men's health specialist with over 30 years of experience treating thousands of men just like you. I've seen firsthand how prostate exams can help, but I've also witnessed how the wrong test at the wrong time can derail a man's health journey. My job is to give you the truth, not the tradition, and to guide you with the wisdom that only decades of experience can provide. Here's the paradox. The same checkups that once offered peace of mind in your 40s and 50s can become risky burdens in your 60s and 70s. What was once life-saving may now expose you to infections, unnecessary surgeries, or months of recovery from complications that never needed to happen in the first place. That's why today, I'm going to reveal 5 specific prostate checkups that men over 60 must reconsider. You'll learn which ones carry hidden dangers, why even doctors often avoid them, and what safer alternatives exist so you can make informed, confident decisions. And stay with me, because the third checkup on this list is the one most men have never questioned. Yet, it's the very test many physicians quietly refuse for themselves. Before we begin, if you haven't subscribed yet, make sure to hit that button and turn on the bell so you never miss another important health message designed for men over 60. And if this video speaks to you, type yes in the comments. If it doesn't, type no, and tell me how I can make it more helpful for you. Now let's get into the very first checkup you need to be cautious about after 60. It's one you've probably heard of, maybe even done many times before, the PSA blood test. Once considered essential, it can quietly become more harmful than helpful as the years go by. 1. The overuse of the PSA blood test. For decades, the PSA blood test has been marketed as one of the most important ways to protect a man's prostate. It sounds so simple. A quick draw of blood, a number on a chart, and you feel reassured that cancer has either been caught early or ruled out entirely. Many men over 60 have built their confidence on this test. In fact, some come to their annual visits expecting it, almost demanding it, because they've been told it's the smart thing to do. I understand that instinct. For years, I too encouraged my patients to monitor their PSA regularly, believing it was the best way to catch problems before they became dangerous. But here's what the textbooks don't always prepare you for. The PSA is not a perfect tool. It's a number that rises and falls for many reasons, and cancer is only one of them. An infection can push it up. Benign prostate enlargement, something almost every man experiences with age, can raise it too. Even sexual activity within a day or two of the test can alter the result. When you're younger, doctors are more willing to sort through those false alarms. But after 60, the consequences of chasing a slightly high number can snowball in ways that are far more damaging than the risk you were trying to avoid. I remember a man named Robert who came to see me when he was 68. He had lived a clean, healthy life. He exercised, ate well, and was enjoying retirement with his wife. His PSA came back just a little above the normal threshold. Nothing alarming, but enough to raise an eyebrow. He was sent for a biopsy, which led to complications. Within days, he was in the hospital fighting an infection from the procedure. He spent weeks recovering, and his confidence in his health was shaken. And the result? The biopsy found a minuscule cluster of cells that posed no real threat to his life expectancy. Robert could have lived decades without ever knowing it was there. But the fear of cancer and the chain reaction of medical interventions that followed robbed him of his peace of mind and temporarily of his independence. This is what I mean when I say the PSA can quietly betray older men. At its best, it offers reassurance. At its worst, it pulls you into a whirlwind of repeat blood tests, imaging, biopsies, and agonizing decisions about treatments you may never have needed. And treatments for prostate cancer are not without consequence. Surgery and radiation, especially after 60, often carry side effects like urinary incontinence or loss of sexual function. These are not small sacrifices. They change how you live day to day, how you see yourself as a man, and how you share intimacy with your partner. The hardest part is that these choices often come not because you had dangerous symptoms, but because a number on a blood test told you something might be wrong. That's the paradox. A test that was designed to protect your health can end up undermining it. I've spoken with countless men who confessed that the worst part wasn't even the medical procedures, it was the anxiety. Every phone call from the clinic, every waiting period between results, every mention of the word cancer weighed heavier than the condition itself. Worry became their constant companion, even though their bodies were otherwise strong and symptom-free. Does this mean no one should ever get a PSA test after 60? Not exactly. There are situations where it can still provide valuable information. If you have a strong family history of prostate cancer, or if you are experiencing troubling urinary symptoms, your doctor may recommend it with good reason. But the key is this: it should never be automatic. It should be a decision made carefully, with full awareness of the potential consequences. Too many men go into it blindly, assuming it's routine, only to find themselves trapped in a spiral of interventions that offer little benefit at their stage of life. As a physician, my advice is this: after 60, talk openly with your doctor about whether PSA testing makes sense for you. Don't let habit or fear dictate the choice. Ask the hard questions. If this test is positive, what comes next? How will it change my treatment plan? Will it actually extend my life, or only add stress to it? These are not easy conversations, but they are essential if you want to preserve both your health and your quality of life. I've seen men who chose to stop routine PSA testing in their 60s and 70s. Many of them describe the decision as liberating. Instead of living from one test result to the next, they lived with a renewed focus on enjoying time with family, maintaining their independence, and taking care of their bodies through exercise and healthy habits. They were not reckless. They simply recognized that at a certain point, quality of life matters more than chasing numbers on a chart. The truth is, medicine has evolved. Organizations like the U.S. Preventive Services Task Force and the American Urological Association no longer recommend routine PSA screening for men over 70, and they urge caution even after 60. Why? Because the evidence shows that the risks often outweigh the benefits. It takes courage to accept that less can be more, but in aging, wisdom often lies in restraint. So before you roll up your sleeve for another blood draw, pause. Ask yourself whether that needle is giving you peace of mind or setting you on a path you may later regret. It's not about ignoring your health. It's about respecting it and respecting the years you've earned. And if the PSA test carries risks most men never realize, wait until you hear about the next checkup. It's one that seems even more routine, almost harmless, yet it can stir up fear, discomfort, and unnecessary treatments in ways you may not expect. 2. Digital rectal exam, DRE, without clear need. For generations, the digital rectal exam, the dreaded finger test, has been treated almost like a rite of passage for men as they age. Many of my patients still walk into my office bracing themselves for it, assuming it's simply part of being a man over 60. They take a deep breath, grit their teeth, and tell themselves it's necessary. I know the look in their eyes when I put on the glove. It's a mixture of embarrassment, resignation, and quiet hope that I'll say, everything feels fine. For years, we doctors believed this exam was indispensable. I performed it countless times early in my career, certain I was protecting my patients. But experience and research have taught me a more complicated truth. After 60, especially in the absence of symptoms, this exam often causes more harm than benefit. The first harm is emotional. Let's be honest. No man ever looks forward to a rectal exam. It strips away dignity in a way that lingers long after the appointment. Some men laugh it off nervously. Others sit in silence, eyes fixed on the floor. A few confide to me later that the anxiety before the exam was worse than the exam itself. And here's the cruel part. In many cases, all that discomfort leads nowhere. The prostate can feel slightly firm or irregular for entirely benign reasons. And that can trigger a cascade of tests, blood draws, biopsies, imaging, that carry risks far greater than the exam itself. I have seen men endure months of stress, convinced they had cancer, only to find out it was nothing at all. One story I'll never forget is James, a retired school teacher in his early 70s. Every year he dutifully scheduled his physical, and every year he dreaded that one moment when the doctor would perform the rectal exam. One visit, his physician thought he felt a suspicious nodule. That single impression led to 3 separate biopsies over the next year. Each one was negative. Each one left James sore, anxious, and frustrated. He told me later that those months were some of the darkest of his life, not because of disease, but because of uncertainty and fear. He had no urinary symptoms, no troubling signs, and yet he spent a year convinced he was living under the shadow of prostate cancer. What did that exam give him? Nothing but worry. The second harm is physical. While the exam itself is quick and generally safe, it is what comes after that often proves harmful. The human prostate changes with age. It becomes larger, more textured, sometimes irregular. These are natural, harmless variations, but to a probing finger, they can feel suspicious. A false alarm sets off a chain reaction. Suddenly, a man who walked in symptom-free finds himself in a medical maze of procedures. He is poked, scanned, and sampled, not because he was sick, but because an outdated habit insisted he should be checked. Too often, the outcome is unnecessary pain or complications that were entirely avoidable. The third harm is subtle but profound: the erosion of trust. When men go through unnecessary procedures triggered by rectal exams, they start to lose faith in the medical system. They question their doctors, or worse, they avoid care altogether. I have spoken with patients who refused to come back for years because they felt humiliated or traumatized by an exam that, in hindsight, offered no real benefit. And this breaks my heart, because those same men might ignore real symptoms when they eventually arise, all because they no longer believe the system is on their side. So should no man over 60 ever have a digital rectal exam? Not exactly. There are times when it matters. If you have persistent urinary problems, difficulty starting your stream, pain with urination, blood in your urine, or unexplained pelvic discomfort, then yes, a rectal exam can help identify what's happening. If your PSA is rising and your doctor needs more information, then perhaps it has a place. But if you are symptom-free, if your history is stable, then submitting yourself to this exam year after year is not serving you. It may be serving tradition, it may be serving habit, but it is not serving your health. As a doctor, I've grown more cautious with this test. I no longer insist on it just because a man has turned a certain age. Instead, I sit down with my patients and we talk. We weigh the value. We discuss whether it will truly change their care. And more often than not, my patients feel relieved when I tell them the truth, that declining this exam is not reckless, it is wise, it is an act of self-respect. So if you're over 60 and your doctor automatically reaches for the glove, pause. Ask why. Ask what difference it will make. Ask what the plan will be if he feels something irregular. Do not surrender your dignity for a test that may do nothing but stir up fear. Medicine should evolve as we age, and wisdom means knowing when to say no. And if you thought the rectal exam was uncomfortable, wait until we talk about the next checkup. It is far more invasive, carries risks you may not have been warned about, and is the one procedure many doctors secretly avoid for themselves, even while recommending it to their patients. 3. Colonoscopy too frequently. Colonoscopy is one of those words that makes men over 60 instinctively tense up. I've had patients chuckle nervously about it, as if joking could make the thought less daunting. Others simply shake their heads and say, "Doc, do I really need to go through that again?" And I understand them. I remember my very first colonoscopy training during residency, how meticulous the procedure was, how uncomfortable patients looked afterward, how relieved they felt when it was over. Back then, it seemed like the gold standard for preventing colon cancer. And in many ways, it still is. But here's the truth that doesn't get said often enough. Too many men are having colonoscopies more frequently than they actually need, and it's not only unnecessary, it can be harmful. When you're over 60, your doctor may have already encouraged you to get your first or second colonoscopy. That's wise, because colon cancer is most common in older adults. A properly timed colonoscopy can detect precancerous polyps early, and removing them can literally save your life. But the problem arises when colonoscopies are repeated too often without clear justification. I've met men who were urged to repeat the test every 3 years, even though their results were clean, no family history existed, and no symptoms were present. Imagine going through the preparation, the strict fasting, the harsh laxatives, the long night in the bathroom, and then undergoing sedation and a procedure that carries real risks, all when it may not be medically necessary. Those risks are not trivial. Colonoscopies can cause bleeding, perforations, or complications from anesthesia. I once had a patient named Robert, a 68-year-old grandfather who was in excellent health. His first colonoscopy came back clear, yet he was told to repeat it just 3 years later. Reluctantly, he went ahead. During the procedure, a small perforation occurred. He ended up in the hospital, undergoing surgery, and spent weeks recovering. His life wasn't improved by that second colonoscopy. It was derailed by it. Robert later told me, "Doc, I wish I had asked more questions. I didn't know I could have waited 10 years." And he was right. The official guidelines in the United States are very clear. If your colonoscopy shows no polyps and you don't have a strong family history or risk factors, you usually don't need another one for 10 years. 10 years. That means if you have one at 60, you might not need another until 70. Yet, time and again, I see men pressured into doing them more often, sometimes by well-meaning doctors playing it safe, other times by a system that rewards more procedures. Either way, the man who suffers is the patient. He endures the anxiety, the discomfort, and sometimes the complications, all for little to no gain. There's also a psychological cost. I've listened to men describe the dread they feel leading up to a colonoscopy. The week before, they change their diet, rearrange their schedules, and worry about what might be found. Even when the results are normal, the stress leading up to the procedure takes a toll. And if it's being repeated unnecessarily, that toll adds up over time. One patient once confided to me that he almost skipped his granddaughter's birthday party because the prep day for his colonoscopy overlapped. He looked down, shaking his head, and said, "I missed out on memories for a test I didn't even need yet." Those are the hidden costs no one talks about. Of course, I don't want to give the impression that colonoscopies aren't important. They are. Colon cancer is one of the deadliest cancers, and timely screening saves lives. But balance is key. The goal should be to protect you, not to put you through unnecessary risks. As a doctor, I now approach colonoscopy with more nuance. I look at each man's history, his family background, his overall health, and the results of his previous screenings. I've had deeply meaningful conversations where I told a man, "You don't need another colonoscopy for almost a decade." The relief on his face said it all. He felt respected, heard, and reassured that medicine could be tailored to him, not just to a rulebook. So if you're over 60 and someone tells you it's time for another colonoscopy, pause and ask, "When was my last one? What did it show? What are my real risk factors?" You may find the answer is not every few years, but rather not until the next decade. Protect your health, but also protect your peace of mind. Because here's the sobering truth. If colonoscopies are sometimes done too often, the next test we're about to discuss has the opposite problem. It's often skipped when it's needed most, and ignoring it can carry deadly consequences that every man over 60 must hear about. 4. Ignoring the PSA test. I will never forget the day an older gentleman sat across from me, his hands trembling just slightly as he asked, "Doc, do I really need that PSA test? I feel fine." His question struck me because I've heard it countless times, especially from men over 60 who believe that if they don't feel sick, there's nothing wrong. And while I understand the instinct, we all want to believe that no symptoms means no danger, the truth is that prostate cancer is one of those silent threats that can develop quietly, without any warning signs, until it's dangerously advanced. Ignoring the PSA test is one of the most common mistakes I see men make, and it's a choice that can change the course of their lives. The PSA test is simple. It's just a blood test, no more complicated than checking cholesterol or blood sugar. Yet, it has the power to reveal early changes in the prostate before symptoms ever appear. That's the key. Early detection. I've treated men who had no pain, no urinary trouble, no visible signs at all, yet their PSA test flagged something abnormal. A biopsy confirmed cancer, caught early enough to treat and cure. One man in his mid-60s once told me, "Doc, I would never have known. I owe my life to that little test." Hearing that reminded me just how powerful prevention can be. But here's the problem. Too many men avoid or delay the PSA test. Some because they're afraid of bad news, others because they've read controversial headlines claiming it's unnecessary. And yes, it's true that the PSA test is not perfect. It can sometimes flag issues that aren't cancer, leading to anxiety or additional tests. But the alternative, skipping it altogether, carries a much heavier risk. When prostate cancer is discovered late, it's often spread beyond the prostate, making treatment more difficult and survival less likely. I've had the heartbreaking responsibility of telling men that their cancer was advanced, and their eyes always carried the same regret. I should have checked sooner. When I talk with men over 60, I like to be honest about the pros and cons. No test is perfect, but the question I ask them is simple. Would you rather know now, while something can be done, or find out later when options are fewer and harder? Most men, after a quiet pause, say they'd rather know. That's the moment I see the fear shift into empowerment. They realize the PSA test isn't a burden, it's a safeguard, a way of taking control of their health instead of leaving it to chance. I've also noticed something else. The men who do take the test regularly often carry a kind of peace of mind. They tell me, "At least I know, Doc." And that reassurance helps them live more fully, without the nagging question in the back of their minds. Compare that to the men who avoid it, who live with uncertainty, and often come in only when symptoms force them to. By then, the battle is much harder. It breaks my heart when I think about how many lives could be saved if more men treated the PSA test as a routine part of aging, the same way they treat blood pressure checks or cholesterol screenings. Prostate cancer is the second leading cause of cancer death in American men, yet when caught early, it is one of the most treatable. That's the paradox. It's both one of the deadliest and one of the most survivable, depending entirely on timing. So if you're over 60 and you've been brushing off the PSA test, I urge you to reconsider. Talk with your doctor, weigh the benefits and risks, but don't ignore it altogether. Your health, your future, your time with your family, it's worth the few minutes it takes to draw blood. Imagine the difference it could make, not just for you, but for the people who love you. And here's something even more surprising. While many men fear overtesting, what often gets overlooked are the silent risks hidden in the very medications prescribed to them. That's right. Some of the pills you might be taking every day, the ones meant to help, could actually be putting your prostate at greater risk. 5. Overlooking medication side effects. Over the years, I've sat with many men in their 60s and 70s who came to me frustrated. They weren't just dealing with prostate issues. They were also battling side effects from the very medications prescribed to help them. I remember one patient in particular, a retired teacher who told me, "Doc, I thought these pills were supposed to make me better, but now I feel worse." His words stayed with me because it's a story I've heard too many times. The truth is, while medications can be life-saving, they often carry hidden consequences, especially for men over 60, and too often, those consequences directly affect the prostate. Blood pressure pills, for example, are some of the most commonly prescribed medications for older adults. While they can protect the heart, certain classes, like beta blockers or diuretics, can quietly contribute to urinary problems, making men feel like they need to rush to the bathroom more often. Other drugs, like antihistamines for allergies or antidepressants, may relax or tighten muscles around the bladder, creating difficulty with urination. Imagine the confusion for a man who doesn't realize his discomfort is being triggered not by age alone, but by the medicine he's faithfully taking every morning. Then there are medications with even more direct consequences. Some drugs used for hair loss or prostate enlargement itself, like finasteride, can lower PSA levels artificially. On the surface, this might seem like a good thing, but in reality, it can mask early signs of prostate cancer. I've seen men who thought their numbers looked fine, only to later discover their cancer had gone unnoticed. It's a cruel irony, trying to protect the prostate, only to create a blind spot in monitoring it. And let's not forget about painkillers or hormone treatments. Long-term use of certain opioids can lower testosterone, weakening sexual health and further complicating prostate function. Steroid medications, often prescribed for inflammation, can disrupt hormone balance as well. Each pill, each prescription, carries a story of both help and harm, and that's why awareness is so critical. I often encourage men to bring every single medication bottle to their appointments. We lay them all out on the desk: blood pressure pills, allergy meds, sleep aids, supplements, and we go through them one by one. More often than not, we discover at least one that may be contributing to prostate or urinary problems. And the look on a man's face when he realizes the solution may be as simple as adjusting a dose or switching a prescription, it's a mix of relief and frustration. Relief that there's an answer, frustration that no one told him sooner. What pains me most is how many men suffer in silence, assuming their struggles are just part of getting older. They don't realize the connection between their medicine cabinet and their prostate health. I once had a patient who avoided social events because he was embarrassed by how often he had to excuse himself to use the bathroom. After reviewing his medications, we changed one prescription, and within weeks, his life was different. He came back smiling, telling me he'd gone to his granddaughter's recital without a single trip to the restroom. That's the power of knowledge. Of course, I'm not suggesting anyone stop taking prescribed medications on their own. That can be dangerous. But what I am urging is this: be proactive, ask questions, sit with your doctor, and go through every medication carefully. Say, is this helping my heart but hurting my prostate? Is there an alternative that can protect both? Those conversations are not only reasonable, they're necessary. As men, especially past 60, it's easy to feel like life is being managed by a series of pills. But your health shouldn't feel like a trap. You deserve to know what's helping you and what might be quietly harming you, and you deserve to have choices. When it comes to your prostate, ignoring the side effects of medications is like leaving a window open in the middle of a storm. The damage might not be immediate, but over time, it adds up. That's why awareness is your greatest defense. If you're listening to this and realizing you've never had that conversation with your doctor, maybe now is the time. Because sometimes, protecting your prostate doesn't mean adding something new. It means questioning what's already there. And here's the thought I want to leave you with as we move into the conclusion. While medications, lifestyle, and screenings are all important pieces of the puzzle, there's one final, powerful truth about prostate health that ties everything together, a truth that every man over 60 needs to hear before it's too late. Conclusion. As I reflect on everything we've discussed, I can't help but think of the countless men I've met in my practice who carried the same worries you may have right now. They worried about frequent trips to the bathroom, about sleepless nights, about losing a sense of control over their own bodies. They worried that aging meant slowly surrendering the quality of life they once knew. But here's the truth I've learned after decades of sitting across from men just like you. It doesn't have to be that way. We talked about how neglecting regular checkups can turn a silent issue into a serious problem, and how something as simple as a screening could save not only your prostate but also your peace of mind. We explored diet and how small daily choices, what you put on your plate, can either fuel inflammation or protect you from it. We looked at lifestyle factors like exercise and stress management, those daily habits that either quietly strengthen your health or slowly chip away at it. We uncovered how ignoring urinary symptoms is like ignoring the early warning signs of a fire in your home, a mistake that too many men only realize when it's far too late. And we talked about medications, those little pills in your cabinet that can be both friend and foe, and why understanding their effects is just as important as taking them. Each of these points circles back to one simple but powerful truth. Awareness is power. The more you understand your body, your risks, and your choices, the better equipped you are to protect your health and live fully. I say this not as a doctor lecturing from a distance, but as someone who has witnessed the difference these changes make. I've seen men regain their confidence, return to the hobbies they love, and feel proud of their health again. And that's what I want for you. So if there's one thing you take away from our time together, let it be this: you are not powerless. Prostate health is not something that simply slips away with age. It is something you can nurture, protect, and preserve if you're willing to take the steps. Don't wait for the problem to become too big. Don't accept discomfort or worry as your new normal. Start now, because every decision you make today shapes the life you will live tomorrow. And believe me, the peace, freedom, and vitality you'll gain are worth every effort.